Oh, we are super excited. So before we get started, just very quickly, I'm Vikas Sabnani, co-founder and CEO of Marit Health. Just by way of quick background, in a prior life, I worked at a company called Glassdoor, which is basically a career transparency platform for professionals, working in technology, marketing, professional services. I spent 7 years over there as head of machine learning and AI. And then prior to Merit, I spent 4 years in healthcare, working very closely with physicians. And it was at that time I saw this sharp contrast between my time in working at Glassdoor and healthcare, where at Glassdoor I was very inspired by helping people like me working in technology, just making better choices around their careers and just feeling like we are being more successful in practicing our careers. Whereas most physicians you speak with, you will hear that they're trying to escape, their career in medicine because it's so hard to practice medicine. So really with our vision with Merit is to try and bring a lot of that aspiration we had at Glassdoor around helping the community that probably needs it the most, which is physicians, around make them feel like they can be more successful practicing medicine. So extremely psyched by achieving this milestone, getting to 100,000 users on the platform. We are, I believe, the fastest in the category ever to grow from 0 to 100,000 clinicians. But at the end of the day, it's just a number. I think what's most motivating about this is the 100,000 stories of every single person on the platform. There are residents and fellows who are just coming out of training, trying to figure out if they're fairly paid. There are physicians who are moving from one location to another, who are just curious, what the market looks like. There are NPs and PAs who are trying to figure out, whether they should subspecialize or not. And so it's been really inspiring to hear the stories from our users, just finally feeling empowered that they have access to a tool like Merit to make better choices. Most physicians you speak with are trying to figure out how they can escape their clinical practice to do something non-clinical, right? And so we are losing physicians from the workforce faster than we are able to add physicians to the workforce, which is a big problem, within the healthcare system. And so the number one problem we're trying to solve is to help these people find the joy of practicing medicine back, so we can extend the longevity of their careers. And the way we believe, this is how Glassdoor did it. The way we believe you do that is by giving them more autonomy, more empowerment, by supporting them with transparency and tools and resources so that they can just make better choices around where they want to work, what kind of work they want to do, where they should practice, and how they should practice, right? And so it comes down to just bringing more transparency and resources to this community. And this is what we did at Glassdoor. When Glassdoor started in 2008, the idea of understanding salary transparency was so foreign. Like, it was not commonplace to know what it's like to work at companies and how much a software engineer was being paid. And that has changed so much that it's so common. Those kinds of things we just take it for granted, but not in healthcare. It is still very opaque, to practice medicine. And so, yeah, our goal is, our vision is that, we can bring the same kind of empowerment and transparency to medicine to ultimately help physicians, be more successful in their careers. So much in healthcare is opaque, right? Like, as a patient, like, we all know this. Like, I think even as patients, when we go see a doctor, like, we don't know what the bill is going to look like. The doctor doesn't know what the bill is going to look like. And so I think the system overall is just incredibly opaque across the board. It's just complicated. It's very convoluted. And so there is no standard compensation model or structure in medicine. And so it is, given the complexity, it is just hard to understand exactly what goes into it. And add to that the fact that the industry has changed so much. So the employment models have changed a lot over the last 15 years, where the large majority of physicians back in 2010 were owners of private practice. Today, less than 30% of physicians are owners of private practice. Most of them are W-2 employees of a large health system or a PE-backed group, right? And so this notion of setting physician salaries and compensation is actually very new. And it's just happened over the last 10 or 12 years. And so it's rapidly evolving. And so everyone's trying to keep up with it. Given how quickly things are changing and how competitive it is to hire physicians, I believe some of the opacity is by design. Everyone's trying to figure out exactly how to even pay physicians because the compensation structures are so convoluted and complicated. When we started Merit, we actually spoke with many physicians to understand, how did they figure out what fair market value is. And most of them would either go interview with other employers to get competing offers to understand, where they stand in the market, or they would ask their friends what others were making. And that was really the inspiration behind Merit, where we said, what if we could help people get access to not just a few friends' offers, but thousands or tens of thousands of offers. And so that was the idea behind Merit, where we can bring all the data together, anonymize it, but make sure we can pull it together in an accurate and representative fashion so that you have all the information you need.